Super Bowls, it's always fantastic. It's going to be a great game. It's pretty phenomenal when you think about it. You got the young gun, and you got Tom Brady. I didn't swear. You don't have to bleep it out. I guess there were some injuries that might affect the Super Bowl.
Super Bowl, baby.
It's not my style to say Super Bowl, baby, but it's Super Bowl time. Nah, I don't like that. You know, if Tom Brady were to hear and tell me to off.
I mean, so it looked minor. They were talking about it being minor, but then he was out the huge next game.
He was out. The New England, the Buccaneers, and the Buccaneers are in the playoffs. What the hell? That's
what happens when you get the GOAT.
We're not even on, are we? Okay, we're all excited for Super Bowl. We have 4 injuries. Count them. 1, 2, 3, 4. And if you don't know the count, you suck. Because if you didn't grow up watching Sesame Street, you're a millennial.
Sesame Street was still on. It's still on.
It's still on. No, I know, but no one watches it. So, who do we have? So, the Chiefs have 2, Buccaneers have 2. Even match, right? Even Steven. So on the Chiefs side, we have Eric Fisher and Sammy Watkins. Eric Fisher hurt his Achilles. Sounds like he's out and not going to be in the Super Bowl, so who cares? Haha, I know you care. But then we got Sammy Watkins, who's got 2 more weeks to recover from his calf injury. Antoine Winfield, Antonio Brown, Buccaneers, injured. Doesn't look like that they're definitively out, so they've got a couple weeks to heal. So let's take a look. So Antonio Brown, you see him running. He's a wide receiver, big guy. He's running, and then he hurts his right knee. What happened? It didn't look like anything, right? He just kind of ran and kind of not even stumbled. They can see him limp and call off the trainer to take a look, and we have no idea.
I mean, so it looked minor. They were talking about it being minor, but then he was out the huge next game.
He was out. So he's sitting on the field, sort of, taking care of his right knee, and then he's out, So we don't know what happened. There's no data, nothing released out there as of now. So let's just break it down. Like, if it was a minor injury, maybe it was a sprain or a strain. Now, what's a sprain? Ooh, good question. So a sprain relates to ligaments, okay? And typically what happens is the ligament sprains, and that could mean it just sort of stretches a little bit, causes some pain fibers to go out, but it doesn't actually tear. Now, if you look at it through a microscope, you'll probably see some microfiber tears, maybe. And then if in an MRI, it may not even show any tear. It may show some swelling, some fluid, could be anything. A strain is typically related to the muscle. So you strain your muscle, and that means the fibers sort of pull and tug and tear, micro tears of some sort, or not. You may have a bruise, a hematoma, a contusion. What's a contusion? A contusion is basically a fancy doctor word that we use to identify something that only someone with a license to practice medicine can actually use and understand. So, what does it mean? It's kind of a way to describe a bruise or an injury that's minor. You kind of bumped it. Think of it like a Charlie horse. Think of it like those situations where you land and fall, and the only way to tell something happened is you have edema. Again, fancy word for fluid or a signal intensity change on an MRI that's otherwise unrecognizable. Now, you may actually have heard of edema because you can get edema and pitting edema because you get swelling in the legs for people with high blood pressure and other issues, but nice sound effect. I'm a surgeon, orthopedic surgeon. We talk about bones and joints. Those are the only things that really matter, right? Right. Okay. So if it's a minor injury, could he have had a meniscal injury? Sure. He could have had a little twist and maybe there was a microvessel that popped, caused some fluid. Maybe there was a pull or tug on the meniscus, caused some pain fibers. And then once you get pain in your knee, then you get activation of all the inflammatory cascade. And you could even get a secondary spasm, not a fancy word, but it's not really medically accurate because what is a spasm? It doesn't really mean anything, right? It's just a way to describe something that we kind of backtrack to sort of understand. And it typically happens when the muscles have a slight contracture and tighten up to splint your knee. So say, for example, he had a spasm in his hamstring because of a contusion in his meniscus or a derangement. See, derangement's another fancy word. It's used for coding and billing because really medicine is run by coders and accountants now, not by clinical health professionals that are actually licensed to practice medicine, because now health insurance companies are now practicing medicine without a license. Do I diverge? Politics. Healthcare politics. And who's making money? Insurance companies. Right. Okay, so back to the real game. All right. So, where was I? See what happens when you distract my attention? All right, so we're back to that contusion. So he may have had some injury, minor contusion, minor fluid, minor edema. Maybe he strained something, got a little bit of bursitis. Remember bursitis? It just means that bursa are simple airbags. There's potential spaces that could exist in areas between tendons, around joints, and basically act as airbags. So remember, if you've ever landed on your knee and suddenly blew up, or you landed on your elbow and it blew up, those are bursa. And you get fluid in them, and it's called bursitis. Bursitis coming from Latin meaning inflammation or expansion, and that's an itis. An itis. We all know what an itis is. You throw anything on the back of any word, and it's a medical jargon for something inflamed or sore or inflamed or infected, right? Right, okay. So if he had that, then you have to manage with motion, inflammatory management, as well as pain. You can do all of that. He'll go to the therapist, get everything he needs, topical, manual, physical massage, oral anti-inflammatories, maybe sprays or creams, any of those fancy massage machines that are out there, whether they're laser or manual physical massage. And depending on the injury, maybe it's something more significant they don't want to talk about. He'll get some fancy injection or a vitamin dose or some IV fluids or some IV vitamins and everything else that can help an acute injury but are not accessible because there's no coding for it by insurance companies, because insurance companies don't want to pay for your health care. Sorry. I just fall into that gravity well.
How do you really feel?
How do I really feel? Sorry, the gravity well comment was related to space operas. I love reading space opera books, by the way. If you have a favorite space opera book, tell me down below, all right? The Expanse was a great space opera book. You tell me your favorite space opera book, and we'll continue talking sports, all right? Down below. Thank you. All right, back to sports. So that, in a nutshell, is what's happening with Antonio Brown, as far as I can tell in general, because I'm not his treating physician or surgeon, but based on a minor injury, if we assume it's inflammation, contusion, bursitis, tendonitis, or strain or sprain of some sort, minor degree, because he didn't really have an instability episode. If he did, it wasn't noticeable on any of the footage that we have. Now, could he have had a grade 1 MCL? Could have. He was feeling the lateral side. You saw him with that sort of ice cold laser massage machine, whatever the heck that was. They got all these fancy tools in pro sports, right? And so he was doing something on the outside. So could it have been his IT band? So sometimes when you land and run, sometimes you can get a spasm, a tightness or contracture of your piriformis. Your piriformis gets tight, your IT band gets tight, and you get a strain all along your knee on the lateral side. Maybe that was it. We see it commonly. And oftentimes with good physical therapists, which I know they have, it resolves. So will a couple of weeks be fine? I'm sure it will, as far as I can tell based on this general observation. And this is going to be a great game. And 2 for 2 players out, each team. Oops. So I would guess that Eric Fisher, as big as he is with an Achilles injury, he's probably out. Unfortunately, he's not going to make the Super Bowl, I would think, just based on the injury that I've read about. It's kind of unfortunate. I mean, if you got this big a Super Bowl coming along, you're going to do whatever it takes to be there. So the other 3, They're going to be there, and we're going to have an awesome game. I'm looking forward to it. Are you?
Who are you going for?
Chiefs.
Really? How come?
I think I like Mahomes better than Brady. I'm just not a fan of Brady. I don't know why. Yeah. I think I was kind of as a 49ers fan, I never liked the Patriots, but...
Yeah. I would never tell him to his face.
Yeah, that's right. I would never tell Tom to his face that I'm not rooting for him. I mean, come on. Are we recording?